Well, we're back with Dr. Bondarev, chiropractor in Van Nuys. Dr. Bondarev, if a person has back pain, lots of people, they associate back pain and chiropractor very, very heavy, lower back pain. If a person has back pain and comes to you, tell us a little bit about, that particular treatment procedure and what is in many cases. Of course, every patient is probably a little bit different, but give us some basic information of what can should be done.
First of all, low back pain, it's the whole world in itself. People try to doctors, I apologize, family practitioners, try to narrow it down to a few things, let's say. They call it either arthritis, which in itself means like something wrong in my nose. The diagnosis of arthritis is so vague I cannot even consider it a diagnosis. Or they call it sciatica. Or they know about disc, but it's not the case. Unfortunately, low back pain is such a wide category that includes in itself so many conditions that it would be pretty much impossible to discuss it in such a short interview. But each of those conditions have different kind of treatment and different approaches. I'll give you an example so you would understand what I'm talking about. Patient comes with a low back pain, and it could be either disc protrusion or disc herniation. It could be a dysfunction of the sacroiliac joint. I don't want to go to this technicality, but sometimes there are very tricky situations, and I'll give you an example of one of them. People suffer from pain in the groin or pain going to the front of their thigh. And obviously, they're looking for help of urologists or gynecologists, which is absolutely reasonable because urologic and neurologic problems do create this pattern of pain. And the scenario sometimes is very not interesting, but it's pretty usual scenario when they come to gynecologist or urologist or nephrologist. Describing this pain, they get thorough examination with a lot of tests done, and doctor says, there is nothing wrong with you, but the pain is still there. You would be surprised, but this pain comes from sacroiliac joint. It's a point where the innominate bone connects with the sacrum. And over the past 26 already years, I've noticed so many situations when work with the sacroiliac joint relieve this kind of condition. And
can you explain that joint one more time a little bit? Which joint that is?
We all know about the sacrum. The sacrum connects to the spine, but there are two bones, pelvis bone that connect each other to the sacrum. They create sacroiliac joint, which could be the source of tremendous amount of trouble. That's an example of how low back pain could be so different from patient to patient. It's number one. And sometimes people experience pain without even knowing that it comes from the low back. When the low back pain is obvious, it's easier for everybody. It's easier for patient, easier for us to diagnose. But sometimes it can be so tricky. But again, the one and only effective treatment for this kind of condition is the manipulative and manual medicine that existed for 4,000 years, and even Hippocrates knew about this kind of treatment. So we provide...
He hung people from the feet to stretch them, huh?
That was the first version of so-called traction therapy. Traction therapy, the old pictures show it. It looks pretty brutal, but it works. It works. Sometimes it works, yes, of course. So we provide this, of course, on a par with the physical therapy modalities like electric muscle stimulation, ultrasound, intersegmental traction, and so forth and so forth and so forth. Plus, at the end of the treatment, at the later stages, we provide rehabilitation with the exercise therapy. But again, we're talking about later stages. These modalities are important, but they important as an addition to the major treatment, which is manual and or manipulated therapy. I usually give the example. People tell me, doctor, I went through a course of physical therapy. Good. What kind of therapy you got? I got electric muscle stimulation. I got some heat pads on my back. I got some massage table and all that stuff. And usually what comes up in my mind is the situation in a restaurant. Imagine that you've been offered meat sauce, but without meat. That's exactly what's happening. All these additional things, they are additional. It's not a treatment. It's an addition to. And unfortunately, people misled and consider this kind of therapy as a therapy in itself, which is not. When
you say manual therapy or manual manipulation and automatic manipulation, give us the two things. Which one is manual? Like if the chiropractor puts his hands on it and pushes or pulls?
It's not necessarily pushing. Manos means